Hi friends, welcome to the channel The Nurse. Here we are discussing about important nursing questions that will be helpful for preparing AIIMS NORCET and JIPMER nursing officer exam. So we will go to our topic important nursing questions and answers with the rationale. If you are not subscribed to our channel, please subscribe. We will go to our question and answers. Important nursing questions and answers. First question, monkeypox virus is mainly transmitted through the following routes except close contact with the lesions, respiratory droplets, contaminated materials, blood transfusions. So here correct answer is blood transfusions. Monkeypox will transmit through close contact with the lesions. It will also transmit through respiratory droplets by sneezing or coughing. Contaminated materials, that is through fomites transmission. These are the three main route of transmission of monkeypox. Apart from that, it is also found that it will transmit through the placenta. So from pregnant mother to newborn baby also will transmit. These are the main transmission routes of monkeypox. Blood transfusion is not to be founded as a transmission way of monkeypox. Next question. Where is the National Institute of Virology located in India? Where is National Institute of Virology located in India? New Delhi, Pune, Kolkata, Bangalore. Because National Institute of Virology is important while diagnosing and confirming the newer viral diseases. And especially it is we heard through the news while COVID time, monkeypox time, etc. So it is located in Pune. The National Institute of Virology in Pune, it is a part of ICMR, and it is known as Virus Research Center, and it was found in collaboration with the Rockefeller Foundation. National Institute of Virology, it is a part of ICMR, Indian Council of Medical Research, and previously it was known as Virus Research Center, and it is found in collaboration with the Rockefeller Foundation. Next question, where is India's first ever brain museum is located? First ever brain museum, AIIMS New Delhi, JIPMER Puducherry, NIMHANS Bangalore, PGMR Chandigarh. First ever brain museum. It is in NIMHANS Bangalore. If you are coming to Bangalore, you can also visit NIMHANS Bangalore Brain Museum. For that, you need to get a prior appointment. That is either through by sending an email, or you can call and ask the appointment. Next question. Which of the following is not involved in Whipple's resection? Which is the following is not involved in Whipple's resection? Resection of proximal pancreas and adjoining duodenum, resection of distal segment of common bile duct, resection of distal portion of intestine, resection of distal portion of stomach. Correct answer. If you are able to understand the Whipple's procedure, you can easily answer question. Correct answer is option C, resection of distal portion of intestine. In Whipple's procedure, it is also known as pancreatico-duodenectomy. Pancreatico-duodenectomy. It is usually doing to remove the pancreatic cancer. Whipple's procedure is used to remove the pancreatic cancer. Usually, it will be located at the head of the pancreas. So, proximal part of the pancreas and distal part of the stomach, proximal part of the duodenum, and common bile duct. Sometimes the gallbladder also removed in Whipple's procedure. So I will show you an example by the help of picture. So usually this is a structure of our digestive tract. From here, the head of the pancreas, usually the location for pancreatic tumors. So proximal part of the pancreas will remove, and the proximal part of the intestine, that is duodenum, and the distal part of the stomach, and also common bile duct. Sometimes gallbladder also removed. So after removal, it will attach to the stomach, directly attached to the intestine. That is usually jejunum or distal part of the duodenum, and the common bile duct. Bile duct, it is attached to the uh, proximal part of the intestine. So like that, it will be attached. It is a very complicated procedures, Whipple surgery. So this is an example of Whipple surgery and resection. Then next question, the position in which a patient is placed while inserting a central venous catheter. Supine position, trend lumbar position, reverse trend lumbar position, high follows position. In which position usually the central venous catheter inserted? Correct answer is option B, that is trend lumbar position. You know very well, trend lumbar position means the head of the bed will be lower than the foot of the bed. So the blood flow from the lower extremities will be more to the brain or our heart. So it will dilate the veins, central veins. So insertion of the central venous catheter will be easier. During the trend lumbar position, the lower extremity, venous drainage from the lower extremity will be increased to the head of the person. So the dilation of the central veins will be increased. So the doctor can easily insert the central venous catheter. And this position also used in some colorectal surgical procedure, gynecological procedure, genitourinary procedure also. And one more important thing, it is used after the spinal anesthesia to increase the spinal flow to the brain. After the spinal anesthesia, the patient will be provided trend lumbar position to increase the CSF flow into brain. Next question, the complication expected by the nurse for a patient who had undergone total hip replacement 24 hours back. Urinary retention, fat embolism syndrome, hypovolemic shock, pulmonary edema. After the total hip replacement surgery, most expected complication. Correct answer is fat embolism syndrome. While doing the total hip replacement, there is a possibility to open the bone marrow and intramedullary cavity. So there is a chance for escaping fat molecules from the intramedullary capillary into the venous system. These fat molecules move up to heart, or sometimes it will move into pulmonary circulation, or it will move into cerebral circulations, and it will lodge or block the venous system, and then it will cause the lethal complication, or sometimes death also will occur. So I told, during the large bone fracture or large bone surgical procedures, there will be chance of opening the intramedullary cavity. In intramedullary cavity, some of the fat molecules escape into the venous system, and it will dislodge or block the our circulation into the brain or lungs or heart. According to that, the patient may die because of the inadequate circulation to the that particular part. Next question, while assessing the characteristic of the dialysate outflow from the patient with the peritoneal dialysis, the nurse notify cloudy appearance of the outflow. What does it indicate? A patient is receiving peritoneal dialysis, and the nurse is assessing the outflow of the peritoneal dialysis. That color is cloudy appearance. So what does it indicate? It is normal appearance, ascites, bowel perforation, peritonitis. The cloudy appearance of the dialysate indicates peritonitis or infection. Usually the normal color of the outflow of the peritoneal dialysis, that is either yellow, that is serous color, or it will be clear. Normally yellowish, that is mildly yellowish or clear. If it is cloudy, that is indicates sign of infection. That is because of the antigen antibody reactions. WBC will attack the antigen, so it will make the solution cloudy. So that is the pathophysiology that is causing cloudy appearance of the outflow. Next question, dumping syndrome after Billroth 2 surgery may be prevented by. Dumping syndrome after Billroth 2 surgery may be prevented by lying down after meal, drinking water after meal, stay in upright position after meal, bend over after meals. In Billroth 2 surgery, the distal part of the stomach is removed and attached to the intestine. So usually the food materials that we are eating will be emptied into intestine very fastly. During the Billroth 2 surgery, the distal part of the stomach is removed and the proximal part is attached to the intestine, and while eating the high content or glucose rich food, that will empty very fastly into the intestine. Usually in stomach, the food materials will be diluted with gastric juices and some kind of absorption will be there and it will stay there for some time. But after Billroth 2 surgery, the distal part is removed. So after the ingestion of food materials, the stomach, it will not be stored. It will directly empty into the intestine. So that will cause irritation to the intestine because of high content of glucose and other food materials, that will cause some kind of complications that is known as dumping syndrome. So it can be prevented by lying down after meals. After the patient had Billroth 2 surgery, means that patients should be advised to lie down after meals for some times. So it will reduce the symptoms of dumping syndrome. Dumping syndrome, that is a condition in which food, especially high in sugar levels, moves from stomachs into the small bowel too quickly after you eat. So the main signs and symptoms of dumping syndromes are diarrhea, nausea, and feeling lightheadedness and tired after a meal. So these are resulted by rapid gastric emptying because the storage time in stomach, that is reduced. Ninth question, the dietary advice for a patient with ileostomy would include. The dietary advice for a patient with ileostomy would include: avoid high fiber diet, restrict the amount of fluid intake, limit the calorie intake, encourage the patient to increase the consumption of milk. Correct answer is avoid high fiber diet. A high fiber diet can also result in indigestible food residue that can block the intestine. So that is why in the case of ileostomy, the patient should be advised to avoid high fiber diet. It will block the intestine. To prevent the high residue food content, we can advise the patient to reduce the fiber content of the food. Next question, left-sided congestive heart failure is most often associated with. Left-sided congestive heart failure is most often associated with dyspnea, distended neck veins, hepatomegaly, pedal edema. During left-sided congestive heart failure, mostly the symptom is dyspnea. In systolic heart failure patients, dyspnea thought to arise from pulmonary congestion, as left ventricular dysfunction causes cardiac output to decrease and pulmonary venous pressure to rise. So I will explain the physiology of the cardiac blood circulations. So from the systemic venous circulations, the blood will reach to the right atrium through inferior and superior vena cava. From right atrium, this blood will reach into the right ventricle. From right ventricle through pulmonary vein, it will go into the lungs. Through pulmonary vein, it will go to the lungs, and from lungs, it will be oxygenated there, and it will return to heart through the pulmonary artery into left atrium. From left atrium, the blood will go into left ventricle. If there is a left ventricular failure or left-sided heart failure, the ventricle is unable to pump the oxygenated blood into systemic circulation. So this will result the congestion of the oxygenated blood at left ventricle. If it is filled, means it will backflow into left atrium. Then if left atrium also is filled then in that condition, the blood will backflow into the pulmonary circulation, or the from pulmonary circulation it will not reach into left atrium. So this congestion will leads into dyspnea, because there is no proper oxygenation occurring, and person is not getting adequate oxygenation into systemic circulation and major organs. So that will leads to dyspnea. In the same time, what is happening in right-sided heart failure? The right ventricle is unable to pump that deoxygenated blood into lungs. So that will result the right ventricle will be filled with deoxygenated blood. Then it will backflow into the right atrium. From right atrium, it will regurgitate, or it will go to systemic venous circulation, that is through inferior and superior vena cava. That will leads to, if superior vena cava is filled with blood, means that will leads to distended neck veins, and if the inferior vena cava is filled with venous blood, means that will leads to hepatomegaly, because hepatic veins are congested. So that will leads to hepatomegaly. Sometimes pedal edema also will be there. So distended neck veins, hepatomegaly, pedal edema are the symptoms of right-sided heart failure. 11th question, which of the following is an early sign and symptom of carcinoma larynx? Which of the following is an early sign and symptom for carcinoma larynx? Crepitations, hoarseness of voice, frothy sputum, drooling of saliva. In carcinoma larynx, the early signs and symptoms include hoarseness of voice, and sometimes it will be prolonged sore throat and cough. These are the main early symptoms of carcinoma larynx, that is hoarseness of voice, prolonged sore throat and cough are the warning signs of carcinoma larynx. 12th question, tissue plasminogen activator or TPA is administered in myocardial infarction 2. Tissue plasminogen activator or TPA is administered in myocardial infarction 2. Control chest pain, reduce coronary artery vasospasm, control dysarrhythmias associated with myocardial infarction, revascularize the blocked coronary artery. So what is the use of tissue plasminogen activator in the case of myocardial infarction? The correct answer is option D, that is, it is used to revascularize the blocked coronary artery. In myocardial infection, there will be blocked coronary artery. If you are administering tissue plasminogen activator, it will revascularize, it will open, or it will dissolve the clot, and it will open the blocked artery, coronary artery. So it will oxygenate the affected part of the heart, and it will improve the condition. TPA, a naturally occurring protein found in endothelial cells of the blood vessels. TPA usually it is found in endothelial cells of the blood vessels, and it will act when it activates, the conversion of plasminogen into plasmin will be there. TPA or tissue plasminogen activator helps to conversion of plasminogen into plasmin. This plasmin dissolve the fibrin clots, and it will helps to revascularize the coronary arteries. If there is tissue plasminogen activator is administered excessively, or there is a overdosage of tissue plasminogen activator, we can use an antidote, that is aminocaproic acid. TPA overdose, in the case of TPA overdose, we can use aminocaproic acid as an antidote. Aminocaproic acid. Then 13th question, for a patient diagnosed with the ARDS, nurse should expect the order to prepare the patient for tracheostomy, mechanical ventilation, non-invasive ventilation, insertion of chest tube. Acute respiratory distress syndrome or adult respiratory distress syndrome, sometimes it will use both the term acute respiratory distress syndrome, or sometimes it will call as adult respiratory distress syndrome also. If patient is diagnosed with ARDS, the first nursing responsibility to prepare the patient for mechanical ventilation, because there will be hypoxemia due to respiratory distress, and mechanical ventilation, it will improve the oxygenation, increase PaO2 and decrease the PaCO2, that is respiratory acidosis. Mechanical ventilation also helps in the rest of respiratory muscles. The patient's respiratory muscles are overworked due to the dyspnea, and during mechanical ventilation, it will rest the respiratory muscles for some times. And main demerits of the mechanical ventilation includes the ventilator-induced lung injury. So that is a main complication of the mechanical ventilation, ventilator-induced lung injury. 14th question, which of the following is not an indication for digoxin administration? Congestive heart failure, atrial fibrillation, atrial flutter, angina pectoris without heart failure. Contraindication of digoxin administration. Correct answer, angina pectoris without heart failure. Digoxin, the indication for digoxin administration includes for the treatment of mild to moderate heart failure in adult patients, in to increase myocardial contraction in children diagnosed with heart failure, to maintain controlled ventricular rate in adult patient diagnosed with chronic atrial fibrillations. During angina pectoris without heart failure, the digoxin may increase myocardial oxygen consumptions and increase coronary artery vasoconstriction that may lead to deteriorate the condition of the patient. So there are three main conditions for digoxin administration. That is, in adult, it will be used for mild to moderate heart failure, and in pediatric or in children, it is used to increase the myocardial contraction, and also it is used to maintain the controlled ventricular rate in adult patients diagnosed with chronic atrial fibrillations. In acute atrial fibrillation, we can use quadron like medications, and in the case of chronic atrial fibrillation, we can use digoxin as a maintenance therapy. But in the case of angina pectoris without heart failure, it will increase the oxygen consumption of the myocardial muscles, and also leads to vasoconstriction of the coronary artery. So that will deteriorate the symptoms. 15th question, which is the most common type of thyroid cancer? Anaplastic, papillary, follicular, medullary. Correct answer is papillary thyroid cancer. I will explain briefly about some types of thyroid cancer. Before that, the thyroid gland is made by two main types of cells, that is follicular cells and C cells. Follicular cells and C cells. Follicular cells helps in the production of thyroid hormone, that is thyroxine, and C cells helps in the production of calcitonin. These are the main functions of follicular cells and C cells. In papillary thyroid cancer, it is affected the follicular cells. Papillary cancer, it is affected the follicular cells of the thyroid gland, and it is very differentiated. It will looks like a normal cells only. So that is 90% of thyroid cancer occur, that is papillary cancer, thyroid cancer. Same type, follicular thyroid cancer also, that is cancer of follicular cells only. But in the case of follicular cells, it is very lesser differentiated compared to papillary thyroid cancer. And it is also a small growing type cancer. Follicular cancer is small growing, and same time papillary cancer is very fastly growing cancer, and it will easily spread into the lymph nodes. Same time, another third type of one more cancer is there that is affecting thyroid gland, that is Hurthle cell carcinoma. Carcinoma of certain types of follicular cells is known as Hurthle cells carcinoma. That is rarely seen, so that is not that much important, but you need to understand Hurthle cell carcinoma also a type of thyroid cancer. Then fourth one is medullary cancer. Medullary cancer, that is affecting into the C cells of the thyroid gland. Medullary cancer, that is affecting the C cells of the thyroid gland. And fifth one that is anaplastic cancer. Anaplastic cancer means the cancer cells are not differentiated. We cannot identify which type of cells are affected, and that type of cancer is known as anaplastic cancer. So there are 5 types of thyroid cancer. In that, papillary cancer is mainly 90% of thyroid cancer, and papillary cancer, papillary thyroid cancer, follicular thyroid cancer, and Hurthle cell carcinoma are affected mainly follicular cells of the thyroid gland. Medullary thyroid cancer is mainly affected in the C cells of the thyroid cancer. Then 16th question. A person with head injury is not able to understand or comprehend the language, but verbal response is fluent. The condition is termed as Wernicke's aphasia, Broca's aphasia, conduction aphasia, global aphasia. So here the keyword is patient is unable to understand or comprehend the language, but same time verbal response is fluent. So that kind of aphasia is known as Wernicke's aphasia. Wernicke's aphasia. In Wernicke's aphasia, it is also known as fluent aphasia. Why it is called fluent aphasia? The verbal response is he can make a long sentence. That is why it is known as fluent aphasia. But if he is made a long sentence, but the another person is not able to understand what is the meaning of that sentence, he will make a long sentence, but others cannot understand what he is saying. So another name of the Wernicke aphasia is receptive aphasia. Receptive aphasia means the person is unable to understand or receive the spoken language or spoken words of the others. So the person's the understanding problem will be there in Wernicke's aphasia. That is why it is called receptive aphasia. Problem in receiving the spoken or written language. And the same time, it is another name is posterior aphasia. Posterior aphasia also another name of Wernicke's aphasia. Wernicke's aphasia usually due to the damage of the temporal lobe of the cerebrum. In this case, person is able to make long sentence, but it is difficult to understand the others. In the same time, Broca's aphasia means that is expressive aphasia. The problem in expressing the language or words or speaking. That is known as Broca's aphasia. Broca's aphasia also known as non-fluent aphasia because the person is unable to speak the long sentence or the meaningful sentences. But the person is able to tell some short sentence or words. Through that, the other person can understand what is meaning to express. But in the case of Wernicke's aphasia, the person able to make long sentences, but the other person is unable to understand what is meaning. The keywords will be missing in the sentence. But Broca's aphasia, the keywords sometimes he is able to express the keywords, but he will not be able to make long sentences. That is why Broca's aphasia is known as expressive aphasia because the problem in expressing the language or speaking. And the third one is conduction aphasia. Conduction aphasia, it is also known as associative aphasia. It is affecting parietal lobe. Conduction aphasia is affecting the parietal lobe. Broca's aphasia, I forgot to tell, it is mainly the damage is due to the frontal lobe of the cerebrum. Conduction aphasia, that is damage due to parietal lobe. In associative aphasia or conduction aphasia, the impairment is in inability to repeat the words or phrases. The persons know what he has to speak, but he is unable to speak it correctly. But he will try to repeat the words. For an example, that is common example, he will try to speak refrigerator, but instead of that, he will misspell that word, refrigerator or refrigerator, and he is able to understand it is the wrongly spelled. Then he again try to correct it, but he is unable to correct the spell. He will repeat the word, but he will unable to correct the exact word. So that is conduction aphasia. Global aphasia means that is a gross a problem in spoken words or understanding the language comprehension. In that condition, it is known as global aphasia. They are unable to understand very little or no spoken language. The person is unable to speak. They will tell one or two words only. Wernicke's aphasia, that is affecting the temporal lobe. Broca's aphasia, that is affecting the frontal lobe, and the conduction aphasia, parietal lobe. Global aphasia, there is a mass brain injury, then global aphasia will be there. Person is unable to speak or understand the spoken words or spoken language. Then 17, the question, which of the following drug retard the progress of Alzheimer's disease? Levodopa, donepezil, prednisone, vitamin B12. Correct answer is donepezil. Donepezil binds the reversibly and inactivates the cholinesterase, thus inhibiting hydrolysis of acetylcholine. The donepezil that inactivate the cholinesterase, and cholinesterase means that is the main function of cholinesterase, that will destroy the acetylcholine. So if we are deactivating the cholinesterase, means there will be more available acetylcholine in the neuronal junction. So it will helps to conduction of the impulses. So that is the main action of donepezil. But it is not cure the disease. Donepezil only retard the progress of Alzheimer's disease. Last question. Which of the following modes of ventilation lock out the patient's effort to breathe? Which of the following modes of ventilation lock out the patient's effort to breathe? Controlled mandatory ventilation, SIMV, assist control mode, pressure support mode. Lockout means that means especially no need for patient's effort here. Breathing control will be completely controlled by mechanical ventilation. That kind of mode is controlled mandatory ventilation. In controlled mandatory ventilation, the settings, the patient's effort will be 0. There is no need for sensitivity of patient's effort, and other SIMV, assist control mode, pressure support mode and all. It is a supportive mode. If patient is able to breathe, these modes will be assist the patients to take breath. But in the case of controlled mandatory ventilation, the total control of breathing given by ventilator only. There is no need for patient's effort. So that is why the patient is sedated. In the case of if there is a patient is getting controlled mandatory ventilation to prevent the patient's effort. So that is about today's video. Thank you for watching this video. And if you like the video, please click the like button and share with your friends. So if you have any doubt, means you can ask in comment section. I will try to solve your doubts. So thank you.